Alright, so welcome to Cougar's Closet. So we under my tab where we talk about, the phobias and the taboos and all that. So I wanted to know what type of phobia, we're in the lab by the way, what type of phobia this is when a person is scared to leave and go outside. Now I know it's definitely an introvert thing, but this thing is deeper than an introverted thing. So it's called agoraphobia. Agoraphobia is a type of anxiety disorder. A person with agoraphobia is afraid to leave environments they know are considered to be safe. In severe cases, a person with agoraphobia considers their home to be the only safe environment. They may avoid going out their home for days, months, or even years. And y'all, I have to say I have gotten to this point, like, if I can manage to get myself into a position where I never have to come out again, like I never want to be seen again, I just want to disappear. In my house, I just want to disappear. What causes agoraphobia? Psychological factors that increase your risk of developing agoraphobia include a traumatic childhood experience such as death of a parent or being sexually abused, experiencing a stressful event such as a bereavement, divorce, or losing your job. How do I get over my fear of going outside? Your fears have mantra. Note your fears have mantra. Decide the amount of risk you're willing to take. Take it slow. Visualize a positive experience. Go out with a friend. Practice breathing exercise. Practical mindfulness. Symptoms of agoraphobia. More items. It take you so long to get in here to this mess. Okay, we find it. For some, phogo may coexist or lead to agoraphobia, which is an irrational fear of being in situations that are unfamiliar or open places. The fear may cause a person to avoid public places that they feel are difficult to escape, like being in a crowd or standing in a line. Other places that may be uncomfortable for people with agoraphobia may include shopping malls, public transportations, concerts, and shows. These places and anywhere but a person's home can be difficult to go when they have agoraphobia. Avoiding public places might feel like the only way to prevent feelings of anxiety or panic attacks from occurring. Symptoms of agoraphobia. When a person is uncomfortable in an uncomfortable situation and starts to feel like they're going to have a panic attack, they may experience physical behavior and cognitive symptoms. Increased heart rate, chest pain, hyperventilation or rapid breathing, feeling hot, trouble swallowing, high blood pressure, feeling dizzy, feeling sick, ringing in the ears. Behavior symptoms of agoraphobia may include avoiding places or situations where you have to leave your home, only going places with someone you trust, not leaving your home for an extended amount of time, avoiding going places that are far away from your home. Cognitive symptoms of agoraphobia may include feeling like a panic attack is life-threatening, thinking others will judge you for having a panic attack in public, feeling like you may lose control in a public place, thinking you may not be able to escape the situation if you have a panic attack. The severity of these symptoms depend on the individual. It's important to speak with a licensed professional to help with your symptoms. Common treatments for coping with agoraphobia other than counseling may include lifestyle changes. Lifestyle changes a person can adopt into their route may include eating a healthier diet, getting regular exercise, avoiding substances like alcohol or drugs, and avoiding caffeinated beverages. But these are the things I need right now. Self-help techniques. Some self techniques a person can practice to help their panic attacks may include focusing on something that's neutral or visible and breathing exercises. Meditation. If an individual is still experiencing strong symptom of agoraphobia after implementing lifestyle changes or using self techniques and other agoraphobia treatments, a professional may be recommended medication to help control these symptoms. Seeking support from a professional counselor. The fear of going out after COVID-19 may be hindering your social, mental, and physical health. If you're looking for ways of coping with re-entry anxiety support from a professional counselor, contact the clinics at Merrick Valley Psychology Associates today. I don't know where this is. Our clinic provides resources and strategies that may improve your experience with fears of going out. So I've been hiding that for a long time, and now that's been came out. Like, what does agoraphobia hate? Translated, agoraphobia means fear of the marketplace. Generally, busy public places such as supermarkets, shopping centers, trams, trains, planes, and airports are feared the most. However, in public place, even a quiet church or empty park may seem threatening to a person suffering from agoraphobia. How do people with agoraphobia act? Agoraphobia is often but not always compounded by fear of social embarrassment, as a person experiencing agoraphobic fears the onset of a panic attack and appearing distraught in public. Most of the time they avoid these areas and stay in comfort of their haven, usually their home. How do people with agoraphobia make a living? Now I'm interested in this. These kinds of roles include freelance writers or content marketers, virtual tutoring, remote IT support. What is the best medicine for agoraphobia? Serotonin. I got serotonin? No, that's melatonin I got. Serotonin reuptake inhibitors. SSRIs were originally developed to treat depression, but they've also proved effective for helping treat other mood disorders such as anxiety, feelings of panic, and obsessional thoughts. An SSRI called sertraline is usually recommended for people with agoraphobia. Is there a herb you could take? Herb for agoraphobia. Let's see if you could take herbs such as passion flower, cava, St. John's wort, and valerian root, as well as the amino acid lysine and the calcium magnesium, have been used for centuries in folk and traditional medicine to calm the mind and positively enhance the mood. Now, I've never seen passion flower and I've never seen cava, but I have seen St. John's wort, and I haven't never seen valerian root. Well, maybe I can see if that comes in the tea form. What tea can you take for agoraphobia? Chameleon tea, passion flower tea, so it does come in the tea, peppermint tea, lemon balm. What is the best tea for calming anxiety? Yeah. Neutral, relax, hawthorn berry, ashwagandha. I got some of that ashwagandha stuff in there. I got that. Remember I told you I went and bought this ashwagandha, but at the time I was so depressed that when I would take them, when I would wake up, I would return back to the problem harder. But since then, I've elevated a little bit higher. So I could try to visit them again because I sure got some. Yeah. I don't know, y'all. I'm just trying to figure out all these head things, that go on in my head. Like, I'm so sick of the distractions, I don't know what to do. Like in the real world, they call that overthinking. But I can't be overthinking if I got the traumatic wounds to go with it. Each day, I don't know what each day gonna bring. I'm telling y'all, every time some mess go down, I'm right there in it. I've been either sitting in it or I just walked into it. Or I don't know what I walked into. Every time some mess go down, I'm on time. I ain't never late for the mess. I ain't never late for it. I'm in the place to be every time the mess goes down. Yep. Well, that wraps this up. I just wanted to get on here and do some research on this. I might could go in here and take some of this Shango Shanga Banga. I need some. See if it help with my phobia.